Welcome to The Explainer. Today, we are tackling a concept that's absolutely fundamental in medicine, drug clearance. And you know what? It's something that almost everybody, and I mean everybody, gets wrong at first.
So if I asked you right now, what is drug clearance? What's the first thing that pops into your head? You'd probably come up with something that sounds a lot like this. You'd probably say, well, it's the amount of drug your body gets rid of over a certain amount of time, right? I mean, it seems so logical. It's about how much stuff is being removed.
But here's the twist. That idea, that's actually called the rate of elimination. Real, true drug clearance is something else entirely. And let me tell you, the difference is so important. It has nothing to do with amount. It's all about volume.
So here's our game plan. We're going to bust this common myth wide open. Then we'll build up the correct definition, see how it's used in a really important equation, and finally bring it all home to see why this stuff matters so much in the real world of medicine.
All right, let's dive right into that big misconception. We're wired to think about how much drug is being removed, but the concept of clearance forces us to shift our thinking, to think about volume instead. So let's look at the official definition.
See that? The key words here are volume of plasma that is cleared of the drug per unit of time. It's measured in milliliters per minute. Notice what's missing? There's nothing in there about the mass or the milligrams of the drug itself.
Okay, but hold on a second. How can you have a specific volume of blood that's completely cleared? I mean, in your body, the drug concentration just kind of lowers everywhere at once, right? Well, you're right. So pharmacologists came up with this really brilliant mental shortcut to handle it.
In reality, what's happening is that the drug is being pulled from all of your blood plasma simultaneously. So the concentration just gently drops, bit by bit, everywhere. And that's kind of hard to measure cleanly.
So, to make the math work, we use this powerful little thought experiment. We pretend that all the drug that was just eliminated came from one single specific little chunk of plasma. We imagine a volume that is now 100% drug-free. And that imaginary, cleared volume is the absolute key to understanding clearance.
Okay, so you're probably thinking, if clearance is just a volume, how in the world do we get back to the number we actually care about, which is the amount of drug being removed? And that, my friends, is where the elimination equation comes into play.
It's beautifully simple. The rate of elimination, that's the amount per time we were talking about earlier, is equal to the clearance, that's our volume per time, multiplied by the plasma concentration of the drug. So clearance basically acts as a conversion factor.
And the coolest part is, you can prove it just by looking at the units. You take clearance, which is volume over time, and you multiply it by concentration, which is mass over volume. What happens? The volume on the top and the volume on the bottom cancel each other out, and you're left with mass over time. Bingo! That's your rate of elimination.
But, of course, there's always a catch. This nice, neat relationship only works as long as the body's systems for getting rid of the drug aren't totally overwhelmed. This gives us two different situations, or what we call kinetics.
So, for most drugs at the doses we use, we're in what's called first-order kinetics. Here, clearance is a nice, stable, constant number. But if you saturate the system, think of a highway where all the toll booths are busy and cars are backing up, it switches to zero-order kinetics. Now the body can only remove a fixed amount of the drug per hour, which means its clearance value is all over the place. It's no longer constant.
So why are we getting into all this detail? Because this is not just some abstract theory for a textbook. This stuff is absolutely fundamental to prescribing medications safely and making sure they work. Let's see how it plays out.
Now, your total body clearance is really the sum of all the work being done by different organs. You've got the lungs, the liver, but for the vast majority of drugs, the undisputed MVP of elimination is the kidneys.
So here's the thing. In a hospital, doctors can't just directly measure a drug's clearance. It's too complicated. So instead, they estimate it by looking at how well the kidneys are working. And one of the best ways to do that is by measuring something called the GFR, or glomerular filtration rate, which they can figure out from a simple blood test that checks creatinine levels.
And this right here is the whole point. Let's say a patient has kidney disease. A doctor checks their GFR and sees that it's low.
That low GFR is a huge red flag that tells them the patient's renal clearance is also low. So what do? They lower the dose of any kidney-cleared drugs to prevent them from building up to toxic levels. It's that direct and that important.
So that brings us back to our big question. Does a drug with a high clearance value always get eliminated quickly? And the answer is, nope, not necessarily. You have to remember the equation. Rate of elimination equals clearance times concentration. You could have a drug with a ridiculously high clearance, but if its concentration in the blood is super low, it's still going to be eliminated very, very slowly. It's a powerful reminder that it's not just about how efficient the body's filter is, it's also about how much stuff there is to filter in the first place.